Hey, good afternoon, everybody. All right. So today we have a short class, but it's on a COVID update in terms of booster shots. So I know a lot of you have just gotten your first booster shot, so they have come out with the authorization for a second booster shot for certain people. So we're gonna go over what it is and what the requirements are. They are saying that with the spread of the Omicron variant BA2, that certain groups of people, it will be helpful to keep, you know, everything your system kind of on alert and ready to fight off any sort of infection. Right now in the U.S., it's not so bad. I don't think we have very many cases of the new variant, but but in Europe, it's actually spreading, and with flights opening up a lot more, it opens the door to more things happening here. So it's good for us to go over just so we know who's eligible, who's not, and um, unfortunately, like right now, I'm not, but I'll talk about that as we get into it a little bit more when that might happen. Okay, so let's get started. So it says the U.S. Food and Drug Administration and Centers for Disease Control and Prevention authorized a second round of both Pfizer and BioNTech and Moderna COVID-19 boosters Thursday. But this was a while ago, to boost immunity of certain individuals. But whatever Thursday that was, it still hasn't changed. I mean, it could have been, on the 30th, but not sure. But anyway, but it hasn't changed. These who it applies to is all still the same. So according to the California Department of Public Health COVID dashboard, around 74% of the states of California population is fully vaccinated. That's pretty good. About 57% or more than 14 million people in California are initial booster recipients. So at least 57% of people have not only been fully vaccinated, but they've also been boosted, which is good. And current evidence suggests some waning of protection over time against serious outcomes from COVID-19 in older and immunocompromised individuals. So, Peter Marks, director of the FDA, said in a release based on, one of the directors of the Food and Drug Administration, based on an analysis of emerging data, a second booster dose of either the Pfizer, BioNTech, or Moderna COVID-19 vaccine would help increase protection levels for these higher risk individuals. So it's people that they say are 50 years old or older, and really it's more 65 and older is the population that they're looking for, but 50 and older is the range that you can right now actually get that second booster shot. And of course, people that are immunocompromised, which does include individuals that are developmentally delayed or have disabilities. Those people are also, if you haven't, or say, because some people have like asthma, things like that, or just more immunocompromised. So that's the thing. Oh, one moment, please. Oh, never mind, it went right to voicemail. Sorry, we just started the new phone systems today. So if you hear some ringing, they're testing out the phones. And that's what that is all about. But when it comes to immunocompromised individuals, so I will get into where I or other people that work in the healthcare industry will be getting, eventually will become prioritized among those groups because we work with individuals that are immunocompromised, such as nurses, things like that in the healthcare system. As long as you're working alongside people, you want to make sure that are immunocompromised. You want to make sure that we keep those populations as safe as possible. Well, that means that the people working with said individuals also need to be protected in order to keep those individuals protected as well. So for right now, because the numbers are still pretty low and the rates of vaccination and boost are much higher than they have been in California, I'm thinking that's why it's rolling out a little bit slower. But we do want to make sure that we're taking care of anybody that's at a higher risk. So Marks added that first booster dose is key in protecting against severe infections and advises people to get it if they haven't already. So with the FDA and CDC's recommendations, people who are eligible for the second booster will now be able to get their shots. California residents can find a walk-in clinic or make an appointment for a booster using the state's scheduling system. And yeah, so there's a scheduling system. Of course, you can always. I do know some folks that made an appointment at Kaiser. Went over to Kaiser here in Richmond and got it. And I know that Kaiser in Richmond right now does have Pfizer as well as Moderna. They're always pretty full up on everything. So next part, who is eligible? So we'll break that down a little bit more. So the FDA and CDC, we've heard those, Federal Drug Administration and the Centers for Disease Control approved the second booster of Pfizer and Moderna coronavirus vaccine for people 50 years old and older. They can receive this shot, which makes 4 shots overall, or 3 if you got the Johnson & Johnson. With the 2-dose series and initial booster, at least 4 months after their last shot. So that's a big one. So say you want to go get the second booster. Well, you got to look at your vaccine card. If it hasn't been 4 months since you got your booster shot, your first booster shot, you're not yet eligible for the second booster shot. You have to wait at least 4 months. I got mine really early on, so whenever they open up, then I can get my second booster shot. But as of now, I can't. But I have gone that 4 months. So if you haven't gone that 4 months, then you have to wait till that 4-month day almost exactly. So that they'll actually let you get that booster shot. So immunocompromised individuals who are 12 years old or 12 years and older could get a second Pfizer booster at least 4 months after their initial booster. Again, that's that 4 months. People with weakened immune system and are 18 years old and could get 18 years old and up could get the second Moderna COVID booster at least 4 months after their booster. So just remember that 4 months is very important. The second boosters can follow up any authorized COVID-19 vaccine shot. So if you got one that was like Pfizer instead of Pfizer, it's not going to count. It has to be either Pfizer or Moderna, and it has to be on a clear medical card. So previously, U.S. health agencies approved a 3-dose series and 1 booster shot for immunocompromised people. With the second booster, this makes 5 shots overall for this group. Okay, and who is immunocompromised? That's a good question. They keep bringing it up. So people with weakened immune systems include those who are receiving cancer treatment, have gotten an organ transplant, have primary immunodeficiency, or are taking medicine to suppress their immune response. The CDC recommends you to talk to your healthcare provider and about your medical conditions and the vaccinations. So what about other age groups? So the FDA's announcement only applies for adults who are immunocompromised individuals. The FDA will continue receiving data regarding boosters for other age groups. Okay, here's another one. So for those of you who came for our initial on-site Johnson & Johnson vaccine, does a second booster apply to Johnson & Johnson vaccine? So the second booster approval does not apply to Johnson & Johnson vaccine. If you've gotten the J&J vaccine and booster, the CDC suggests that you get a second booster dose with the Moderna or Pfizer vaccine at least 4 months after your last shot. In most situations, the mRNA shots are preferred over the J&J vaccine. So again, it's still 4 months after, but so if you've had the J&J, don't get that one again. They're preferring that you go and get either the Pfizer or Moderna. All right, let's see, and then for the last bit of this, it is COVID in California. So how are we looking here? Currently, COVID-19 vaccinations are mandated in California for children and school staff participating in in-person learning. So basically, if you're going to school, it is mandated to be vaccinated for schools. Um, don't know how that applies to us exactly. There are no statewide mandates on COVID vaccinations. State lawmakers previously pushed for workplace mandates requiring public and private employees and independent contractors to provide proof of COVID vaccination. However, the bill has been put on pause by its author, Assemblymember Buffy Wicks, to allow for more conversation to address concerns. So, it's not a mandate yet for workplaces that you have to be vaccinated. It's been put on hold. So you can look at there's called Assembly Member Buffy Wicks tweets. You can look that up. Just look up Wicks tweets, and it should have some information on what you're looking for if you want to know more about that. And that's it. So if you have any questions, please feel free to ask. I want to make sure that everybody feels safe and knows exactly what's going on in California and what's going on, in terms of program, so that it's not required here yet, but it looks like they're moving towards that vaccination could be mandated. Um, but again, there might be different things that keep people from getting vaccinated. There's still that choice that people have and want to have. I mean, if you look at, say, Kyrie Irving as an example, just kind of the U.S. Um, but he plays for the Nets in Brooklyn, and New York for the longest time had no, sorry, basketball players, they have to be vaccinated. And for the longest time, he couldn't play during the season. Well, they finally lifted that, but not everybody has to be vaccinated. So now he can play home games in New York and away games. Before, he could only play games in the states that didn't require that. Interesting thing, though. So the Brooklyn Nets could play the Toronto Raptors. I think it's the Toronto Raptors, who are in Canada for the first round of the playoffs. Now, Canada requires that anybody has to be vaccinated. So, if they do end up playing Toronto, say in the first round or whatever, anytime they have to travel to Toronto for the home games, Kyrie cannot go because Canada has much stricter guidelines as to who can and who can't be there. So, like I said, it's much different around the world the way it's going. In the U.S., there's a lot more choice still if you want to or not, but mandates might be coming down the pipeline. So, just a little overview, things to think about, but has it happened yet? No. So this is where we're at currently, and it's always good to know where you're at. All right. Hope I didn't bore you too much, and hey, the phone didn't ring that much. All right. Y'all have a wonderful rest of your day. I'll talk to you later on.